guys, welcome back to another episode of the Fill Me In podcast. I'm Injector Jon.
And I'm Aesthetic Nurse Nicole.
Thanks so much for tuning in this week. It's crazy. I feel like every single week we get more and more listeners and new people, whether it's patients or just new injectors that are coming on the industry, and it's really exciting.
I know. I can't thank everyone enough for taking the time out of their day to listen to us.
Yes, because to us, this is something so little, but like it's touching a lot of people, which is great.
Yeah.
But this week we're going to be talking about lip augmentation, guys, which honestly, we haven't talked a lot about lip augmentation. It's honestly one of the most highly requested services, I feel like, in any med spa. It's Botox and lip filler, right? It's been like that forever. But obviously, how we inject lips has totally evolved over the past few years. And obviously, there was the era of the big lips, which... Listen, we all fell victim to.
We all fell
victim to it. I fell victim to it. I felt like a bad bitch. I'm not gonna lie. I dissolved them. I'm gonna start doing little bits at a time, but it still is an era of lips, don't you think? But and I think it's trying to reel people back in to maybe refine them a little bit more and maybe changing our ways too, because I think some of it is our fault as well.
Well, if I think back, if I think back to when I started, it was just Ultra Plus all the time.
Yeah.
The smaller the lip you had, the thicker the product we chose, because in our minds, it was like we were going to create more of a difference. When in reality, it's just splooging out of that lip and
literally causing a mustache
everywhere. Yes.
Oh my God.
But these are things that we learn with time, Oh,
100%. But we also know with lips, like it's such a huge area for facial harmonization too. Like there's some patients that come in and they're not even coming in for lip filler, but we look at their nose lip to chin ratio, look at their profile, and we notice that they're more, is it concave? Convex.
Concave, but like more,
like their lips sit more inward from their chin and their nose.
What would be the term for that?
I think concave.
Yeah.
Right.
Receded. They're a little bit more receded in that area.
Yeah. Like their chin and their nose stick out, but their lips are inward. And sometimes too, I mean, we had a dentist on, remember?
Yes,
and he was saying sometimes people just need teeth as well. Like just giving them bigger teeth that can fit their face a little bit more will help to push their lips forward too. But we sometimes tell patients, listen, if we do a little bit in your lip, it's going to help you from the side. It's going to make your nose and your chin look smaller. It'll make you more harmonized.
And I hear that all the time from patients. And I even noticed it on myself when I did my lips. My nose looked smaller in proportion.
Sure.
Because you're adding more volume to the lip.
Right.
And some people with people that feel like they're very like long or they have a lot of chin, when you treat their lip, they feel like that looks like it's more in proportion too.
Yeah. 100%.
All about balance. But
all about balance.
We're also seeing now the dissolving trend.
Yeah. And Avery
Woods is on the top of that right now. And I really want to I'll have Joey put in her picture because it really actually changed her whole face. I think the issue with her was they were almost using too much of a robust product and it looked unnatural in a sense of when she was talking and things of that nature. So I'll have him put these in, but it just, now that she's taken it out, she looks so much more herself.
Yeah.
And there's a way to do lip filler. There's products to use, which this whole episode is going to be about all of that. And if you have the volume for it, you can do those robust products. But if you don't, you look a little silly because your lips look plastic, And
the other thing too is knowing when to stop too. I think even if you use like Rheology, right, which is like the chemical makeup of each filler, if you use the filler that's appropriate, like Juvederm Volbella or Ultra, right? Like sometimes if you layer filler over filler too frequently, sometimes too, it can kind of like make the lips look heavy. And when you smile, you see less of your teeth and it just doesn't look right. It changes the way you express.
And as a practitioner, I feel like that is one of the hardest things to explain and educate to a patient in your chair, because they just have this picture and they're like, well, why can't I look like this? And we have to respect your anatomy, and we can't change your anatomy fully. We can only work with what's there. And a lot of the times people want that lift and curl up of that top lip. And in a lot of people, that's surgery only, 100%. We're only going to get that surgical lip lift, and not everyone's open to that, but filler can only do so much. So that's like a very big educational point. which doesn't always hit home with the patients, you know?
Yeah. And the lips can only get so big too. I think it's really hard. It's frustrating. Like when you have like friends that get their lips done and they're like, oh my God, but their lips are like bigger than mine. And they feel like they hold it better. But me, it just doesn't stick, or I just want mine to look like theirs. But your lip anatomy is totally different. Like you might even have good lip shape, like from the outside. You're like, oh, okay. Like I feel like there's good distance, like height already. You're thinking, oh, they're going to hold it well. But then when you go to feel it, sometimes their lips are thin. Like there's just no lip tissue there.
There's no space.
There's no space there for the filler to integrate. And if the filler can't integrate, then it's not going to stay as long.
Right.
And you might have issues with lumps or bumps.
Exactly. Yep. And that's the other thing is the lumps and bumps. Like, why do some people get no bumps, but other people that first week to 2, they're so lumpy and bumpy. And I really do think that comes down to the integrity of the tissue. Like some people just have very thin lip skin.
Sure.
And you're just going to feel the product more. It's not so much that it's obvious or evident by
lip skin. I can't.
It's like a different type of skin, right?
Listen. Yes, it is a different type of skin.
When you like, I almost kind of have like when you see those little lines in the lip, like you know that maybe you shouldn't do too much tenting because that's going to pocket, filler. Do some more linear threads rather than too much tenting,
I know.
But it's just, everybody is so different. And some people just have a high metabolism.
Yeah.
Like I have it's rare, but I have a good handful of patients that it's like 3 months and it's gone. And they do it for events and things like that. And they know like, okay, I'm going to come like a week and a half before my event so that I still have something. But then I have patients that will go a year or 2 years without doing any lip filler and they hold.
And it still looks great. And you're like, I know.
Yeah. And there's really no great explanation for that besides sometimes lifestyle, nicotine.
Oh yeah.
But really it's just, it's your own body. It's your body kind of viewing it as a foreign object and trying to get rid of it,
That's the tough thing is the vaping and the smoking and like, even like, smoking weed, stuff like that. Like if you have someone who chronically is smoking, it's so not good for lip filler. And it's like, I hate, like, it just is just because you're using that muscle so much. And especially like during that first week or 2, it's so crucial. If you're constantly pursing your lip to smoke or vape or do whatever, you're going to potentially move or migrate some of that filler and it could cause it to lump or bump. So like, I always have to tell my patients, like, if you really have to, like, do it off the side.
That's what I tell them too. Yep.
I'm like,
you want to close like straight. You don't want to be puckering. Yeah.
And you might look weird for the next 2 weeks, but you're going to protect your investment,
Yeah, because when you think about it, the more you use that muscle, the more it has potential to slide that stuff around.
Oh yeah. And metabolize it too. I feel like any patient that vapes or smokes, they metabolize it quicker.
Yeah.
Right?
Yep. Absolutely. That nicotine really gets their heart rate up and then it speeds up that metabolism.
Yeah. And just that repetitive motion of the orbicularis oris too, just will eat it up.
Yeah, because you don't realize, I mean, if you are a smoker or a vapor, like how many times are you hitting that a day?
Yeah. The other thing that I wanted to talk about too, I feel like we've seen, and maybe you've been doing this forever, Nicole, but like, I feel like when I first started 6 years ago, I was, doing lip, but not incorporating so much lip flip with it.
Yes.
As well, or doing Botox above it. Like it's really important to have your patients animate when they smile. Like if they at rest they're like beautiful, but when they, beautiful lip shape, whatever, but like when they smile, if it curls under and disappears, you really need to do Botox there to relax it because they have a higher chance, in my opinion, right, of migrating and also metabolizing that filler.
Yep. Because every time they're smiling, like it doesn't happen to me or you, but you're like, if you tuck under like that, yep, it's gonna move it around. 2, it's gonna break it down quicker,
and it works
moving it more
so well though. Doesn't it work so well? And patients love it.
Yeah,
they're like, oh my God, I have an upper lip when I smile now. Plus, like, I feel like my filler's lasting longer.
So the lip flip is basically utilizing a little bit of Botox right at the lip line to roll the lip forward. So when you smile, instead of tucking, you smile and it comes and it rolls out.
Yes.
You can also do like the gummy smile is a really big one. So hitting that L-san muscle that kind of comes down and pulls the lip up this way. Some people, I'm actually one of them. When you smile real big, you can show a little bit of gum. So you can also do a little bit of like a unit or 2 right next to the nose, very superficially, and drop that too.
Just lowers it a little bit.
I do a lot of like gummy smile with lip flip at the same time. Usually like 10 units, and I do like 6 along the lip, and then the 2 and 2 at the L-san.
Yeah, it's really smart to do it. And it's really just important during your consultation to assess your patients, and not, if they're just in for lips, don't just do their lips. Like, have them smile, have them animate, take before pictures. Because I found now that I'm doing that way more over the past 3 to 4 years and really focusing in on their facial features and their animation, it really has changed my treatment plan for them. And also makes it known to them, like, oh, this is, if you set realistic expectations based on their animation and a good assessment, then they're going to be happier in the future. And they're also going to know why things are happening.
Yep.
You know what I mean?
How many times do you treat someone and then they come back and they're like, I never had this little line before.
Right.
And you pull up their pictures and they did, but
and they did.
No one looks at their face like someone that has just been treated, you know? So if you don't point these things out beforehand, they're going to see them after and they're going to blame you for them.
100%.
Yeah.
Yes, definitely.
Especially the smiling pictures, I think, are huge. People don't realize when they smile that, you know, there might be some asymmetries in the smile or more tooth is covered on one side than the other.
Yeah.
A major, huge common thing that I see that I tell patients about all the time is like, we typically, and you can see it on me even right now, we typically have a side that's more rounded and a side that's more flat. And I see it on probably 90% of my patients. We all have it. Trying to get this flat side to round out like this round side, nearly impossible. We will try and we will do some tenting and, you know, do what we can to match them perfectly, but you're never going to be 100% symmetric. And that's something that you have to basically relate to them beforehand, because afterward they're going to blame you. They're going to say it's the filler. Like, no, it's your lip shape, you know?
There was an injector that just recently, I think, posted a reel showing like how asymmetry is beautiful. And then I think showed like it was celebrities, and if they were symmetrical, what they would look like. And it does not look good.
And they look crazy, right? Yeah.
Yeah. Yeah. It's crazy. Like what we see in a mirror and like in person, what our friends see. Like, you know, like if I'm looking at you, like people just look symmetrical, but when you look in a mirror,
right.
Or like, you know, and you take a picture.
If we were to break it down
with your camera, like forward, you're like, oh. But then if you go on Instagram or Snapchat and take a picture, you're like, ooh, it's just interesting.
The Snapchat camera is my favorite.
It is, because it
I don't
makes
know what
you
it
look,
does, but it does something.
It makes everything look symmetric and perfect. I don't know.
It like airbrushes it.
It does.
But it's important too. It's hard. Again, sometimes I feel like a lot of this stuff is a little bit deeper than just what we do, but getting across to a patient that that's normal and everyone is asymmetric. Some people just don't believe you.
I know.
Some people really fall for the Facetune and the Face app. And, you know, even on there, you can make your lips bigger. Like just because that person looks like that does not mean they look like that in person, you know?
Yeah. And, you know, also I also want to like normalize getting your lips dissolved or even spot dissolved. I can't tell you how many patients that, you know, my returning patients that come in, I'm just, every time you're in for your lips or whatever, I'm always assessing them, feeling them, looking in the wet border. And if there's any type of like little migration there or even above, sometimes doing a spot dissolve, you know, I'll do that. You know,
you don't always have to start 100% from scratch.
No. Just maintenance. It's lip maintenance.
Right. And even, I don't know, we were talking about this earlier. I'm not sure if it's the pregnancy and me swelling or if it's just, I mean, I probably have at least 6 or 7, maybe even 8 syringes of filler in my lips and various fillers over time. But my bottom lip is starting to like, if I go like this, you can see all this old filler just kind of like slowly making its way out. So sometimes you just have to spot dissolve those areas.
Yeah.
And it's funny, I am someone that I have no bottom lip. Like I always had a top lip, but it took us years to build my bottom lip. So it makes sense that that's the first one to kind of need a refresh, you know?
Yeah, no, 100%. Yeah. And like I said before, that orbicularis oris muscle that's around our mouth, like we use it for straws, putting on chapstick,
As I put a straw in my mouth right now.
Literally, like we use that muscle for everything. So over time, if it's been 4 years later and you haven't been dissolved and you have no migration, that's pretty freaking amazing. But if you do, it's normal. It's normal. I feel like we need to get away from, yes, is there bad technique? Yes. You know, is there choosing a wrong product for the lips? Yes. But we can't always just blame the injector. I'm huge on that, especially when patients coming in, you know, some people are quick to blame that person, but it's so hard because if you've had filler for 4 or 5 years and it's now migrating, it's normal.
Yeah. And that is a discussion that I have with all of them too. Like when we do decide to dissolve, like, you know, unfortunately this can happen again, you know, and it may not be in the same time frame, but we may be down this road again, having to dissolve again. And
Totally.
you know, don't be surprised if that does happen, because it's, you know, at the end of the day, it's our body. We're kind of, we're relying on it to heal. Right. And it doesn't always, you know, doesn't always work the way we want.
Hey guys, just popping in to remind you to like, subscribe, and hit the bell for notifications. Also, don't forget to follow us on Instagram, Injector Jon and Aesthetic Nurse Nicole. Thank you so much for watching. And if you have any questions, leave it in the comment section.
Now, Nicole, has your techniques changed over time with lips? Have they? Like, how would you say, like, when you first like start, even like the first 3-4 years, like to now, like what is different? Like, what have you done differently?
Well, I would definitely say 1, product choice, which I really want to get into. I think we should talk about that for sure. But 2 is really how I'm laying the product. So I feel like back in the day, I would start right at the border and I would lay these linear threads right at the border, and
like horizontal or vertical?
Horizontal. Yeah. Like I do a good amount of tenting now, which is more of those vertical ones. But back in the day, I would do one right at the border horizontally, and then I would come into the body of the lip and just do another one. And that was it. Like, it was
crazy.
Cookie cutter for everyone. It's how I learned. And I'm telling you, it was always Ultra Plus. Like, I didn't accident to any other product. It was always Ultra Plus.
Wait, it's so funny. Everybody, I feel like, says that too. They're like, Ultra Plus and lips.
It was just what we knew. Yeah. It was, and it was, I feel like we were learning from, you know, these surgeons and doctors and people that really had their hands on it for so long. It was just Ultra and Ultra Plus.
Yeah.
You know, so it was the things that we were learning as coming into the field. So now and this is again why you continue your education, because things always change. We're always learning new techniques. But yeah, I always did that because the thought behind that was that laying 2 threads like that would roll the lip. So that was what we did. And, you know, with the Ultra Plus right at the border like that, God.
And would you say, were you in the vermilion border?
Oh yes, 100%. Yeah.
That was it. That was normal.
Yep.
I remember when I first started, it was, you would start literally in the lower vermilion, you'd go up. It was creating the definition, right? Yeah. And then you would kind of follow it and then do the bottom, and then you would go into the body after that.
Yep. And it probably would honestly look great right away. But placing that product in the vermilion border is what kind of over time caused that mustachy, you know, especially a thick product. I still inject the vermilion border, but with the right products, you know?
Yeah. I feel like now, I mean, I inject just below the vermilion border. You know what I mean? Like, we kind of always, now we're kind of veering towards injecting more superficial, not as deep, right? Yep. Making sure we're above that muscle, right? But then also, if we're doing the vertical linear threads to give height, we're starting that injection point in the red of the lip.
Yes. And never above. Yes.
Yeah. And that's if you are starting your injection point above the red, like where that white is, then you're going to have issues with migration 100%. And people coming back saying they look more duckish. And
exactly.
if more filler
lifted
is laying on top of the lip, it's actually going to weigh that lip down. So when they smile, it's just going to look more like heavy. You know, heavy.
They call it the Marge Simpson. I call it a shelf. Like, it's just going to go forward. It's not going to go up.
Yeah.
And that's why adding too much volume, because the more you add, the less definition you have and the less lift you have. And that's really hard to get across to people too.
I can't preach enough. You know, you can't shove a whole syringe of filler in every lip.
Yeah.
That's why I offer, and I know you do too, I offer half syringes or full syringes. And even when I say full syringes, sometimes I'm not putting that full syringe in, but I'm doing the majority of the syringe, right?
Yeah.
But people that can handle a full syringe are people that have good pre-existing lip tissue. They have wide enough lips in diameter, right? Enough room for that filler to settle, right? If you have a small mouth, I tend to go more with a half syringe, because a half syringe can go a long way, and you can always add more. If you're coming in and your protocol is just to do one syringe, come back in 2 months, do another full syringe. If you have the lip, you might be able to support it. It might look beautiful, right?
Yeah.
But for some people, it's not, especially if you have really thin lips. If you have really thin lips, like if you are literally looking at me and I can't see the red of your lip and I'm going to shove a full syringe in there, which we've done before in the past, right? It's just, you're going to have a migrated lip.
And that's what we used to do. We used to take that thick product and we'd be like, okay, you had one, you're going to have to come back in 3 months for another. And we were doing such a disservice to these people because their anatomy would never handle it.
Right.
Now we know.
Well, now we know. Yeah. Oh my God. Yeah. It's how we were taught. It's right. And then now we're kind of like, wait.
And it was that back then. It was everyone. Really was. You know, there really wasn't. And no one knew yet.
Now I feel like too, Nicole, how I inject lips. It's a little bit more superficial. Like I'm not seeing the gray of my needle, but I'm definitely seeing like foot in a sheet or foot in like, you know, it with that mucosa and the dry border.
Yes.
And I, at first when I started doing it, I was like, oh God, I hope I'm not going to get lumps or bumps or too much superficial, those little bumps. It's beautiful.
Yep. And that's why I really take the time too afterwards to heavily massage.
Yes.
And I know a lot of people are like, oh, well, if it's placed correctly, you shouldn't need to massage, blah, blah. Like, no, you need to massage this stuff. It needs to integrate into the tissue, especially in the lips.
Before they go home, you need to make sure like it's
You're
like
not
skin
feeling
beef.
anything. Yes. Yep.
Right. You want to make sure that you really smooth that bump out if you have a little bump.
And I always tell patients, I show them how to massage, but I always tell them I need to know. And again, they're going to feel the filler. So if they've never had it before, explaining to them that it's going to feel like a density, like you're going to know there's something in there. But if it feels like a pebble or a stone and it's an isolated spot and it's hard, that's what I would consider a bump. And that's what I want you really kind of pinching over and pinching and scratching with some Vaseline or Aquaphor to kind of really flatten it out. But if it's not going anywhere and it's visible, I need to know about it because then I can usually massage it out for you and you don't even have to worry about dissolving. Or sometimes we lance them and we express it out if it's a decent enough bump. But usually if we get it early enough and we massage it, we can flatten it right out. Yeah. So it's kind of, again, about education and explaining to them how it's going to feel, what to expect and what to let us know about.
Yeah. What would you say is your number one used lip product?
Ultra for sure.
Ultra. Yes. And say why.
So Juvederm Ultra, I explain it to my patients like it's the perfect middleman. It's dense enough where it's going to give you volume, but it's not too dense like an Ultra Plus or like a Voluma or something of that nature where it's going to be too hard or heavy in the lip. I think it gives really good definition and it has enough of that fullness to it where it holds the shape where
and
something
it's hyalocross, right?
Yes. So you're not,
Yep. You're so it's not as responsive or not as reactive as well.
Reactive. Yes. So you're a little less chance of lumping and bumping compared to other products. But I will say another top pick of mine is Volbella, which is a Vicross. But it is just so soft
and so like soft and pretty.
Yeah. And like, honestly, I think it is fairly moldable. Like if you get in there and massage it right away, I do love that one too.
Wait, like sometimes I'm like, you know, the patient comes back and I've done a half and I'm like, how are you still this full with Volbella?
I know with Volbella. Yeah.
I'm like, but that, cause it's honestly like the princess of fillers, right? Yeah. It's like, it's FDA approved for infraorbital hollows, but like, yeah, right.
I do think it has something to do with the fact that it's Vicross. So like Vicross technology, for those that don't know, it's the way that the HA is cross-linked, and Vicross is meant to last a little bit longer, which is why it sometimes comes along with a little bit more of adverse events and things of those nature. But I think because of that in the lip, even though it's a very thin product, it holds well.
It does,
because it's not a hyalocross. You know,
and it's also meant to very giving. It's how do I say it? Like if you're looking just to enhance.
Yes. It's like internal lip gloss, I call it. Yeah. It's still gonna give you volume, but it's not going to be like an Ultra. I explain it. Ultra's doughy. Yeah. Ultra has that doughy, pouty look where Volbella is more of that shapely, little bit of touch of hydration. Yep. And that's it. Yeah.
I will say too, I agree. I use the majority, Ultra and Volbella in the lips. Occasionally I use Velour as well, which I think is really pretty too. Not every lip I use Velour, but obviously it has that 18th month longevity to it, which is really great. So if someone's really looking for that longevity, I will use that. But I will say Ultra is my number one go-to.
Yeah, me too. I also use, so in the lip, I also use Versa, Refine, and Define. Refine and Define are from Restylane. Versa is its own company, but from Revanesse. But Versa gives you that little extra point too. So sometimes if you do have someone that's like a little bit fuller lip, because the fuller the lip, the more product you really do need. If you do a half syringe on someone with a really full lip, they're going to be like, what'd you do? Yeah.
Great point. Touch base on that, because a lot of people think because they have already really big lips, they only need a little, but they actually do to see a difference.
Yeah. Yeah. So that's huge. Like that's another big education point to your patients. If they have naturally full volume, if you do a half syringe, they're going to call you in a week and be like,
it's gone.
You did nothing. So they need a good amount of product. So sometimes I do choose Versa for those people because I get that extra little point too, gives them a little extra something. And then Refine and Define, I love Refine, tends to wear out fairly quickly in my opinion, but I really like it for a lip that I need something forgiving. Like if you have paper thin lips and I need to try to tent and give you height, like I need something that's not going to bump or, so like Refine is one of those more forgiving products, or like if you're learning, Refine is a really good one. Define, I like, it reminds me of Ultra in a way, but it definitely takes a longer time to heal. I've done Define in my own lips, just testing around, messing around with certain things. And I had a bump for 6 weeks. It eventually did go away, but again, it's a thicker product and, it's definitely more chance of bumping. So you just have to keep that in mind.
Yeah. Yeah. I love that. Good. Let's talk about Rheology a little bit. I mean, we kind of touched base a little bit on it, but there's obviously certain fillers that are meant for certain areas of the face. Like Voluma and Volux, technically, definitely Volux should not be used in the lip.
Yeah. I will say I have in 3 patients in my whole almost 8 years done Voluma in the lip.
That's why I'm looking like this, because I've definitely used Voluma in patients' lips, but it's for certain patients, certain people.
Yes. Yes. You have to be the right candidate. And it's on people that just metabolize, like they metabolize like crazy. They don't hold anything else. It is my last resort. I really probably haven't done it in 3 years. But I have done it to try to get people a little bit more longevity, but you cannot mess around with that. You can't tent, you have to just do linear threads, horizontal, because it will lump, it will bump, it will end up in the mucosa. It's a product that's meant to pull water and spread and be thick,
I know.
So you have to be careful how you place it.
Yeah. So that's why, honestly, like the favorite lip products, I feel like, and this is worldwide, or at least in the United States, would be Ultra, Volbella, Restylane Kiss, Restylane Refine.
Yeah.
Restylane Classic. I see some people use.
Do. Yes. Yep.
I think Beauty by Dr. K. I feel like I've seen her use that. And her lips turn out really pretty.
The RHA collection now is pretty popular for the lips too, I think.
Oh yeah. Right. RHA, Redensity, and then 2, and yeah.
Yeah, those are all very popular.
I've never used RHA, so I don't.
Yeah, no, me neither. I like to explain it to patients too. Like it's like Coke and Pepsi, like all these different companies. It's just different brands. They all have kind of the same thing of, where Define might be your Ultra Plus and Refine might be a little bit more like your Ultra, but it's definitely thinner. But like they all have their things. It's really just about, what you've learned with and what your hands are comfortable with.
I will say for me, and I think Nicole, you would agree. And you remember how I was about a year ago. I didn't do as much Ultra on the lips. I was mostly Kiss and Contour. I was using a lot of Restylane Contour and Kiss, and I've kind of converted a little bit more, and I'm using more Ultra XC, and it's just a personal thing. This is not knocking anything, any product, but Ultra definitely, for me and my patients at least, lasts longer in their lips.
I would agree.
And I just feel like it's more giving, and I felt like Kiss, for me, some of my patients, Kiss is beautiful on. Like I'm like, wow, like we did your lips a year ago, full syringe, it's still there. Great. Well, let's stick with it. Like, and I'll do Kiss again on them. But I would say the majority of people that I've done Kiss on, like it just doesn't last as long. And I converted them over to Ultra, and they're really happy with Ultra.
Yeah. Yeah. I will say too, like they definitely just see more of a result and they feel like that result lasts longer.
Yeah.
Yep. I've noticed that from my own practice too. Cause it's funny that you brought up Restylane L, cause like I totally forgot that even existed.
I know.
But in my early years, that was majority of the lips that I did was Restylane L, but it would be gone.
Yeah. And I actually used Restylane L or Classic only for under eye filler. And, I've kind of stopped it. I've only used Volbella in the under eye.
Yeah.
And it's been great.
I love Volbella in the under eye.
Yeah, it's great. It doesn't pull water.
It's so soft. Yeah, because I did do, again, back when I first started, a lot of Restylane L in the under eye too. And I just feel like you ran into a little bit more tindling and a little bit more of that swelling after the fact with it. Let's talk techniques.
Oh, let's talk techniques. I love it because I feel like
we talked about how I started, what I started doing versus what I do now. What would you say is your lip technique at the moment?
I would say my go-to, and every patient's different, but I would say the majority I'm injecting more superficial, number one. I think that if they already have good height with their upper lip, I am actually starting more by the oral commissure in the upper lip and I'm doing a little horizontal and I'm injecting horizontal retrograde. And then I'm coming up and I'm just underneath the vermilion border for these. And then that next injection, I'm bringing the needle right up to that GK point, which is the start of that Cupid's bow on that side that you're on. And I'm doing a little horizontal retrograde, coming back, staying in, and then I'm going like a little V.
Yep.
Right, just like this. And then seeing how that looks. And then I'll come up and I'll do some vertical linear threading to give a little bit of height. I like to accentuate the V of the Cupid's bow, the GK points. I'll do it again on the other side. Sometimes I will, depending on the lip, if they have good height already or they're responding and they're stretching well, I'll find that wet border and go up just a little bit from that into the dry border. And I'll just kind of be superficial there, and I'll do a little bit of a layer there to kind of be the base.
Yep.
Just before that wet border, but not within the wet border, if that makes sense.
Yeah. Well, and some people need like lip support too. Like your older patients, you can't just do their lip because it's going to look like indented. So you really have to maybe use a skin weave or a velour to get in there and make sure that everything looks seamless on the around the lip as well.
But I would say I'm doing a combination of horizontal retrograde and vertical linear threads. And I'm also doing that in the lower lip as well. However, if they already have a really pouty bottom lip, and if we're just trying to improve ratios, then I'll work on that upper lip to give it more height. And then once I see a good ratio, I'll go to the bottom and I'll do more horizontal retrograde. And just to make sure that I'm not doing the same exact technique in the lower lip, then we're like back to square one of like, oh my God, now we have a fat bottom lip and it doesn't look right.
The ratio's off.
Does that make sense?
Yes, absolutely. Yeah. You don't want to pull that too forward.
Yeah. So that's what I would say my technique is.
Yeah. And I love that you brought up the Cupid's bow too. And even the bottom lip. Like, I think it's important to talk to the patients first. Like, are you happy with your ratio? Do you want to try to change your ratio? Do you like your Cupid's bow? Cause I've done that where I've like, I love the look of a Cupid's bow. So I do it on everybody unless you tell me otherwise. But you know, there's patients who are like, oh, they're so pointy now, you know, like some people like it more rounded where you just wouldn't touch it, you know?
I know.
So it's all about that consultation beforehand too.
My thing is that rounded Cupid's bow, they want it rounded. And some people if you already have a good Cupid's bow,
there's no rounding it.
We can't round it.
Yeah.
And if
I
we
explain
round
that
it
at least 2 times a day.
and if we round it, it's going to look migrated.
Natural. Yeah. It doesn't look natural. Yeah. We can inject you where we don't emphasize it further, but even doing the horizontal, filler will fill it up and it will emphasize it a little bit. Like if you have a Cupid's bow, unfortunately there's no getting rid of that.
No, I agree. I have like, I would say 3 or 4 patients that are extremely fast metabolizers. The only thing that works in their lip is voluma.
Yeah.
But they also have good pre-existing lip tissue. Like they have the tissue there to like support that.
Yep.
But even before they're going, I'm like massaging the hell out of them just to make sure, and not the hell out of them too hard to where it's like moving it, but I'm just really making sure that we're not lumpy bumpy.
They're numb at that point. So it's like the perfect time to get in there and do it. Yeah. How would you say if you do end up like a lump or a bump, how you handle that situation?
Yeah. I generally don't like having my patients massage it at home. I tell them the first 5 days to leave their lips alone, because during those first 5 days, that's when you can have some post-injection swelling, and also it's hyaluronic acid gel, right? So it's going to draw a little bit of water to the lip. So it's normal for the areas where the filler are to swell a little, so you can feel it. It almost sometimes feels like mashed potatoes. So sometimes I say that's not like really whipped.
Like a lump in the mashed potato.
Yes. And you want to like chew it like immediately. And then usually I tell my patients, if it's someone I can really trust, right, that feels comfortable doing it at home, I'll tell them after day 5, if you continue to feel like a little lump or there, take your thumb and index finger and massage it out.
Exactly.
You won't move or migrate it. You should smooth out. But if you're nervous to do it, just call the office and we can get you in, and I can have me or Alicia do it. Yeah.
And massage it out for you. Yeah. Yeah. I think a lot of time, even so, I typically tell them 24 hours. And then if they do feel any hard spots I like to use the term like pinch and scratch. So I show them you're holding the lip steady above, you're finding the spot and you're pinching and scratching right over the spot with like a Vaseline or Aquaphor to give you slip, and obviously very clean hands. But I tell them to give it at least a full 24 hours. But sometimes if that doesn't resolve, I'll either have them come in and spot treat with Hylenex, which I don't love to do because Hylenex is very unpredictable. So if it's superficial enough, I'll just lance it with a needle and express that. Because filler, when placed in the right plane, should integrate like all these little tiny little spots with your tissues. It should be fully integrated with the tissue. If it's too superficial, it doesn't have the opportunity to integrate. So it almost sits like a little ball at the surface.
And it's kind of bluish gray.
Yep.
And then you could just poke it with a needle. It's so easy. Just
like a pimple.
Yep. Yeah. And then express it. Yeah.
But a patient would never, for patients listening, you would never do that.
No, don't do that at home.
Leave that to us. Yes.
Yeah, 100%.
Leave that to us. That's for the practitioner. So and again, it can happen to anyone. Like, it's not, sometimes the filler's in the perfect plane and then it's nothing you did, or maybe you did do a straw, or you're a vapor or things like that cause it to move a little forward, or it just settled a little bit into a pocket, and it's normal. If we have to do it, we do it. And it always heals nice and smooth after the fact.
Right. I agree. I love that.
Yeah.
What else did we want? Oh, let's just talk about like post-care instructions for lips.
Oh, yes.
So, and a lot of you that are injectors know this, but post-care, the huge thing is to keep those lips clean the first 48 hours. So using like Aquaphor, Vaseline, something new at home. Don't use any old lip products for 2 days. Technically, you're not supposed to wear like lipstick or like lip stain or anything for 2 days. So
because it's really, you have to remember these things are in there long term.
Right.
So even because people think like, oh, well, I didn't get an infection. Like, it doesn't matter in a month, 2 months, 6 months.
You could seed.
Exactly. You could get a nodule because bacteria got in there from the beginning. So you really have to make sure that for that first 48 hours, you are babying those things. Like, don't let your dog lick your face. Please, God. Any old chapsticks. I will usually give people like an alcohol swab or two, because I feel like sometimes they don't always go out and buy a new one. Like, I'm like, all right, at least wipe what you have. But I prefer clean hands, wash your hands, and do a Vaseline or Aquaphor, like you said.
I agree. No hot tubs or saunas for about 2 days. No working out for 2 days. Electric toothbrush. Do you say anything about that?
I think as long as you're
there's this like notion up here in upstate
that
New
the
York
electric toothbrush is a problem.
That it's a problem. Unless you're literally holding the toothbrush on the lip to vibrate it, like, which you're not.
No,
like you're brushing your teeth.
Yeah.
I think it's fine.
Yeah. I know that it's funny because people ask me like, well, can I eat? I'm like, of course you can eat. Like, maybe don't pick like a chicken parm sub, but like,
nope, don't eat. Starve yourself. My gosh, I know.
Spoons and subs are probably going to be a little hard.
One thing I'll say too, though, oh my gosh, and this one patient of mine, if she is listening to this, she would laugh. Literally, it was probably my first year of injecting. So like 6 years ago, I did her lips. She went to Dinosaur Barbecue, which I don't know if you've heard of that.
No.
It's this barbecue joint place, which is great. Love it. It's like a staple here in Syracuse. She went there after had like spicy ribs or spicy something.
Oh no.
Oh my God. Her lips blew up.
Oh God.
Because like think of the spice, like the cayenne got in there.
Putting it right on your lips. Oh my God.
Oh my God. Like it was like, I mean, like they were huge. And she of course freaked out. She DM'd me. She's like, oh my God, freaking out. Like, what do I do? And I'm like, take a Benadryl.
Yep.
By tomorrow it should be fine. Like, and it was. But like that spice, I always say, try to avoid spicy food. Don't go to Chipotle that night.
It's funny that you bring that up because same thing. A couple years back, I had a patient, sweetheart. She called me the next morning and was like, my lips are black. And I was like, okay, that is a major issue. I need to see you immediately. And like, she was older. So sending pictures was like not an option. It was a little too, she couldn't take the picture of herself and then email. It was too much. So I was like, okay, I need you to get in here. I need to see your black lips. I put an alcohol swab to them and she had eaten frozen blueberries the night before.
Oh my God.
And it was like a residue of the frozen blueberries.
Oh my God.
And she felt so bad. She was like, oh my God, but like, this is why you see your patients, cause like in my head, I'm like, oh my God, she has an occlusion and it's already too far gone. And like,
God, I know.
But it was blueberries. So it's like, and always just make the time to put people at ease. That's what I always say. Like, even if it's just sending pictures and emailing them back, like just see your patients.
Oh, Nicole, let's talk about cleft lip.
Oh, yes. Or even scars. Just like scars. Yep.
Because
great point.
I'm sure you get some patients in with those.
Yeah. So I actually have a lot of patients with decent scarring. And scarring can be difficult to work with because filler likes to sit on each side of it rather than integrate with the scar. So you really have to kind of take the time to make sure that you're injecting evenly and looking at it, always having them express while you're injecting. So like smile, let me see how it's like, looking and making sure that it's not pulling too much one way. And patients will always definitely be more sensitive there too. So that's something to keep in mind.
100%. I know I've had a few patients come in with a cleft lip and one of them I was able to do like a treatment on, which is great. There's some I just can't, like, it just depends on that scar and
how much the tissue's like folded in.
Right. And if it's too much folded in, then filler's going to stay on each side of that scar and it's just going to look, it's going to make the curtain. Yes.
Yeah.
I was trying to find a good way to say that. It's the curtain.
The curtain. Yep.
Yes. 100%. And I felt so bad. Like, it's like you want to make it better for them, but it's like you can
almost make it worse.
You can. Yeah.
And it's important too to explain to those people too, they are definitely considered more high risk because any kind of injury and scarring is going to change how the vascularity is underneath the skin.
So true.
So it can make you more susceptible to a vascular occlusion.
It's like a facelift, right? Like any type of like change in your, that's why we need to ask, like, have you ever had a facelift or any facial surgeries? Yeah. That's a good point.
Yeah.
Love it. All right. This was a great combo.
I know. I feel like I could talk about lips all day because I literally used to be the lip queen.
Yeah.
That's all I did all day for like 3 years of my career.
Oh my God. I know. Same. I feel like it was just toxin lips and like, look at like my practice is toxin pout.
Toxin pout. Yeah.
And obviously we do way more than just treat lips like now with like, but it's crazy.
Well, and that's again, let's touch on that real quick. The rebrand, like, it's important, as we all start somewhere. Like I started, if you go back on my Instagram, all I posted was lips and I did everything. And people would DM me like, oh, I want to come see you to get my lips done, but do you know anyone that could do my cheeks? And I'm like, yeah, me.
Yeah.
Like, but they didn't know that. So it's, you have to be so careful about what you're posting and showcase what you can do,
I know. Well, I think I was telling you the other day, I felt like all I've been posting is stuff for other podcasts, about facial balancing, about, biostimulators, PDGF, whatever. And then someone asked me like, you still do lips, right? And I'm like, oh my God, are you kidding? Yes, I do lips all the time. And I'm like, shoot, I literally look back and I think the last 20 posts were not lips. Like I'll post them on my story, but I almost
not everyone sees that. Yeah.
Right. And I don't know if you think this way. Like I almost think people are sick of seeing lips all the time.
Yeah.
And, they want to see kind of everything.
Which is so funny because even though I do and you do the same, like so much facial balancing, I would say still at least 50% of my practice is just lips.
Oh yeah.
Yeah. It's still such a popular thing. And it's also like the younger crowd, people that may not need other things yet. That's kind of how they get their foot in the door and a little bit of tox and stuff. But you're right. We forget to post it.
Yeah. I think I was looking at my top 5 services I have like over the past year. Yeah. And obviously it's Botox, it's neurotoxin, right? Is number 1. And then number 2 is mini pout, full pout.
Yep.
One of the 2. And then it's facial balancing, Sculptra. Yeah.
Those bigger things.
Those bigger things. Yeah. But I think lips are always going to be very, very popular. And they're kind of the gateway to get people in the door.
Yeah.
Too.
100%. Yep.
Yeah.
Yep.
So anyway, well,
this was a fun one. Thank you guys for listening.
Yes. Thanks for tuning in. If you guys have any questions, shoot us a DM and comment on our reels. We absolutely love it. The engagement with this has been so fun. And I feel like it brings people together and we love hearing from you, what your techniques are, what you're seeing in your practice. So love you guys. And thanks for tuning in to another episode of the Fill Me In. Till next time.